lab coat and everything, so at least we can take the garments afterwards and wash them in a separate batch, from the rest of the people, to try to minimize the contact of the rest of the population. So we as a healthcare worker, we are taking our part, and we are gonna be seeing those patients that they are suspicion, in the back, in the parking lot, or in your car at your best convenience. Now, it's not the fact that we don't want to see you, we want to provide the service, but we want to protect the rest of the population. For one person that is sick, there's 5 people that they are not sick and they have severely bad diseases such as diabetes, heart failure, and COPD. So those people are more vulnerable to you. And we wanted to minimize, their death rate, that this virus has. This is a virus like any other viruses. Main prevention says, if you are coughing and you have suspicion you've been in contact, please provide with a handkerchief or something that you're gonna have in your mouth. Try to get it all the time. Try to not take it off. The mask is not, a luxury. It's a prevention for you transmit for the rest of the people. It's the responsibility of every person that is sick to get and protect the rest of the population. It's a public health issue. So it's very important and it's paramount that everyone takes care of the rest of the people. It's a principle of solidarity. We need to be solidary with the rest of the people and not get them sick. So as a matter of fact, if we do this, it's been proven to prevent different things. People has been asking me about Neosporin use in the nose. It hasn't been proven to help, but it hasn't been proven to not help. So in my opinion, my personal case, and I'm going to leave it up to everyone, I'm going to use the Neosporin, in my nostrils, every day in the morning. So at least I provide humidity in my nostrils and at the same time provide with a mechanical barrier in the nostrils to avoid the virus transmission or the entrance in the virus from your nostril. So it's very important to do all these measures. Why? Because we see the existence of the mask and also supplies for cleaning and everything. They are, absolutely gone, and we are still a little delayed because the factories are trying to manufacture more, but the first line of treatment is the healthcare workers. So I wanted to make the conscious of the people and healthcare providers. If you are a healthcare provider, if you are a nurse practitioner, or anybody in the staff, if you feel that this information is pertinent, I have experience in public health, and we've been asking around to infectious disease specialists, and at the same time, what's the best way we can do to prevent this transmission. And one of those things is, try to get it like a biohazard transmission, because the droplets, they stay in your clothes, in your hands, in all your garments. So try to get a way to clean those things. Second clothes, and preparedness is very important, for the people, not to get paranoia, but at the same time, to get prepared in home. Like in the case you need to be in quarantine, you need to have enough food supply for at least a week or two, and I think that's very important for every person. In the case, God forbid, we have this case, we have a case of coronavirus, we have to stay in home, with quarantine. The quarantine is not a way to say, we're not gonna use the the medical resources. No, the quarantine is for you to apply the principle of solidarity with the rest of the people and not get them sick. This is not a time to take lightly and say, oh, I'm sick and I'm gonna go to work. Well, it's not the case. Oh, I'm sick and don't worry, the other people to protect themselves. No, this is not about that. We need to be kind with the rest of the people, try to prevent. If you get sick, well, pray to God, we're gonna get well and everything, and it's gonna be a mild illness that it's in 80% of the cases. So with these preventions, I think it's I'm able to get the comments. If you have any comments or anything else, please leave it in the chat and everything. I'm gonna publish this video in the Facebook, so at least the people has access to this. But like I said, summarizing, one, prevent the contact with washing hands and protect yourself, with the handkerchief if you don't have a mask. Like if you are gonna come physically to the office, please provide with the handkerchief yourself, and try to have it all the times, and not spreading it. You're gonna be instructed to go to the back, and possibly a person from the staff is gonna go and assess you over there outside. The reason behind it is because the air is gonna be outside, and it's not gonna be in a confined environment in contact with the other people. So one of us is gonna be seeing you, and like I said, if you have a contact, with a person that it's confirmed case and they are very sick and they have the following symptoms: high fevers documented, dry cough, that is not productive, no sore throat,